Well, hello there, Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, and Canaan. Well, today we're going to talk about neuropathy, and specifically, probably the easiest way to determine if you have neuropathy. Okay, what is neuropathy? Well, it's nerve pain, duh, but also neuropathy typically comes about for a couple different reasons. One of the one of them is if you drink too much. The alcohol, the high sugar content in the alcohol, kind of kills the nerve endings. Okay, it does a lot of other things too to damage the body, but it really does a number on the nerve endings. So your nerves are not as sensitive as they could be, and it starts to basically tone down the ability of the nerve to communicate with your brain. Not a good thing, especially in the feet. The hands, a little more tolerable, but typically the feet, because they're further away from the heart, are going to be more problematic. Basically, alcoholism creates a whole host of comorbidities in and of itself, but as it relates to neuropathy, it just makes the clinical picture so much more difficult to treat because you're really not going to get anywhere treating someone who's not going to stop drinking. Um, that would be the primary way to address that aspect. But here you have your chemo-induced peripheral neuropathy, and what happens with the chemo-induced peripheral neuropathy is the chemotherapy is a toxin. It kills the cancer, but also kills the nerve cells, primarily the cells that cover the outside of your cells. These cells, the myelin sheath allows for really fast transmission of nerve impulses. Like if I was to write a number on your foot, you should be able to tell me what that number is without looking. And that communication travels, I think it's almost 270 miles an hour. I mean, it's pretty fast. And when you can't feel it or you can't tell me what that number is, it gives me an idea of how severe your peripheral neuropathy really is. Um, so it's kind of a tough one, but the diabetics are faced with this uh, because the sugar also eats away at the myelin sheath and also affects autonomic blood flow. So the three things you have to worry about is there enough nerve stimulation? Is there glucose regulation? And is there enough oxygen to get so you have okay blood flow, oxygen, glucose, stimulation? I guess four things, and those are the primary drivers of neuropathy. How they come about, as I said earlier, chemotherapy is a toxin that will kill off the myelin sheath, make it much more difficult. Um, the diabetic, you're not going to have the same blood flow as with diabetes. I mean, chemotherapy can also affect the blood flow, but not as much as the diabetic, as diabetic is more of a chronic, long-term condition, and hopefully chemotherapy is a short-term thing, but it does take time for those nerves to spark back up. And the way we do it is we offer a bunch of really different therapies um, to address it. And some of these therapies are oxygen therapy. Wonderful. I mean, you're not getting enough oxygen. We do a pulse oximeter. If you're not getting enough oxygen to your feet, well, we have to put you on what's called a vibratory plate and supplement that with oxygen. So we're pumping oxygen. You're basically on this machine. It's going to get blood flow to your feet, but we're also supplementing with oxygen. There are nutritional things we can do and offer. Those are harder to get people to follow because you're not going to be here in the office. A lot of the stuff we're going to do is send you home to do. But I will focus today on the in-office procedures. Another thing we found to be very effective is a technique called blood flow restriction. And blood flow restriction is a technique where you would let's just use the legs as an example. You have night pain or burning sensation or tingling in your legs, loss of balance. These are some of the symptoms of peripheral neuropathy in the lower extremity. So what will happen is we will tie the elastic bands around, basically around your hip, and tighten them, and then take you through a series of exercises. And what happens is your body's like doing, and I'm not talking about crazy hard exercises. These exercises anybody could do, and we're only going 40% of your max. So say you could, um, you know, do a leg curl of 100 pounds, but we're only going to use 40 pounds, and it's a set number of times, set number of reps. So what happened then is when you're doing this particular exercise and with the blood flow restriction bands on, you are going to experience a you're going to experience a deficit. Your heart's going to notice, hey, listen, I'm not getting, the muscles are going to start the deficit. I'm not getting enough blood flow. I need more blood flow. And what happens is you're working the muscle harder. And then once we take the straps off, it engorges the muscle and it has a really profound effect. Bodybuilders use this to build up muscle as well. But I mean, here we are. If someone has neuropathy, chances are they're not a bodybuilder, unless it's unless they're drinkers, the alcohol-induced neuropathy, or if they've had chemotherapy. But typically, it's not what we see on a regular basis. So the average person will benefit from the blood flow restriction. Another thing we do is we use infrared light therapy. It's like a form of laser. And what it does is it stimulates production of nitric oxide. Nitric oxide is very, very important for opening and dilating blood vessels, which means we're going to get more blood flow to your lower extremity, more quality. Um, Another way to think about nitric oxide is it's how the erectile dysfunction medications work by stimulating production of nitric oxide. So it opens up the blood vessels and it gets the blood flow to where it's needed the most. Pretty good stuff there. I mean, it really is good stuff. Um, the other thing we got to do is we got to really fire up those nerves. We do that using a special machine from Germany called the Hakamed, and the Hakamed is our tool to really fire up stimulation in that area. I mean, into lower extremities or the upper extremities. But I gotta be honest, we see more lower extremity effects with neuropathy than we do upper extremity. I mean, the arms are sensitive and the fingers can be sensitive, but the fact that the legs are further away from the heart, that's one of the reasons I think we see more neuropathy cases affecting the lower extremity. Now, another thing I want to touch upon is probably the easiest way, because listen, you can go to your doctor, he's going to say, okay, take this pill. And let me tell you something. You got gabapentin, which is an anti-seizure medication. You got Lyrica and Cymbalta. You'll see enough advertise it. They use it for shingles. They use it for any kind of nerve pain. If you're already on several medications, the last thing you need is yet another medication. Okay, that is a problem. But that's the only tools they have, and they want you taking these medications. Oh, well, take this one. And what'll happen is it just doesn't work. I mean, most neuropathy cases they say is not curable. Take this pill. And it has so many comorbidities. I mean, just ask your pharmacist if you're taking, if you have neuropathy and your doctor puts you on a medication, ask him what the comorbidities are, or read the paperwork that goes with it most of the time. I think you really don't want to be taking too many medications. You got to give your body a chance to heal. So the protocols we use are natural. There's no side effects, and it can let your body start to spark up and work its way back, so that you can start enjoying a normal quality of life. So what we did is we started a separate practice within a practice here. It's called Neuropathy Core Health. And it's not really a chiropractic treatment. So we want to differentiate it, which is why, again, we came up with a different name, Neuropathy Core Health. And when we have special days, we put aside just to treat neuropathy cases. But the stuff we send you home with is probably the real meat and potatoes, because we're going to have you doing therapies every single day at home, which is a lot easier than having to come to the office and hopefully get a more compliant and yet a better result. But when you go and present with neuropathy, chances are they're going to do a nerve study. And the nerve study is one very, very expensive. I mean, it's crazy expensive, as a matter of fact, but it's also very, very painful. What we do differently here is, because our protocol is not an insurance reimbursed thing. We use therapies that they don't even recognize and probably won't for another 10 years. Now, do you want to wait 10 years till they recognize to get covered? Well, that's up to you, but we don't. We can't deliver the care we need for you to see the results that you deserve using insurance. So it's a non-insurance product that we offer. But we've done is we take what's called a thermal imaging scan. And what we're able to do is visualize, and you can see just as much as we can, are you getting adequate blood flow to the feet? And if you're not, well, we have to rectify that. We have to rectify it. So there's a lot of stuff that we have, but I think it all centers in if you have neuropathy, or you may have it, you may not have it. You know, if you're suffering with neuropathy, I'd say the easiest thing to do is come in. We do have a special offer, $47. You come in for the thermal imaging scan. We take down a few measurements. We go over a few different other tests as well. We check see if you're getting enough oxygen to your extremity. Um, we test the nerve to see how fast that nerve is transmitting. We test light touch, deep touch. So we do a pretty good neurological exam, and it lets you know the severity. Because here's the thing: is a lot of the symptoms of neuropathy are very subjective. Maybe you only have night pain where your feet or your legs feel like they're on fire. And you have to get up and walk around, shake it out a little bit, and blood flow will start to restore the back to normal feelings. That might be just something that you can live with. Now, here's something you probably can't live with: balance issues. Are you aware if you have a balance issue? These are some crucial things to be aware of, because if you have a balance problem and you're not addressing it, you are really at a serious risk for fall. And a fall risk, as you get older, it becomes more and more devastating, to say the least. I mean, I would have to say it's because so many people who fall, break a hip, break a bone, they end up in a nursing home, and the morbidities there are, well, actually, just think about the people who may have fell down before COVID, and they're in a nursing home catching COVID. So there's a lot to it. You don't want to fall, and that's the thing too. Is the balance test is really important, because we got to restore as much balance to you as possible. I mean, that stimulates the nerve if we're working on balance things as well. So that's what we do differently here at Neuropathy Core Health. And again, I'm not just a chiropractor, which I guess is get a better explanation as to why we have the title, not just a chiropractor. But if you're interested in getting the neuropathy scan, the thermal imaging scan for neuropathy, it's $47. It's a lot less painful than going through the needle stuff, the needle EMGs that you would go through with the physiatrist or the neurologist, and it'll show you right away. On numbers 203-875-0846, 203-875-0846. Thank you very much, Dr. Brian McKay.